There is a misconception that varicose vein disease is cosmetic and not covered by insurance. That's very far from the truth. The majority of patients that we see in our practice are potential candidates for insurance coverage. In my experience with symptomatic varicose vein disease, the majority of patients' insurance companies nowadays are covering therapies, particularly if the patient has had significant symptoms that have been documented by the physician and an ultrasound has been performed documenting the severity of the underlying condition that's causing their varicose veins. Cosmetic treatments are not covered, so if a patient comes in strictly with a cosmetic concern but no real symptoms in their legs, that's not going to be something that's covered by insurance because it'll be considered cosmetic. 100% of patients with only spider veins and spider veins only, those will not be covered by insurance because they're really not a medical problem. They're really just a surface appearance problem, and it's going to be considered cosmetic by insurance. In terms of vein disease that is often covered by insurance, varicose veins that are symptomatic are very frequently covered by insurance in terms of them allowing for not only the workup of the disease but also an interventional treatment as long as they've met the insurance requirements. The insurance requirements vary from insurance carrier to insurance carrier, but some of the requirements for insurance companies to cover varicose vein treatments is that the varicose veins actually be symptomatic, that the varicose veins have been studied by a physician using ultrasound. We have to usually assess for an underlying condition referred to as venous reflux disease. And if you have that underlying disease, then it's considered more of a medical necessity to fix the varicose veins because they end up progressing to a more serious problem if it's not taken care of. Another reason that insurance companies would consider varicose veins as a covered benefit is if you've actually had a complication from your veins. For example, if you've developed chronic swelling in your leg, if you've developed chronic pain that won't go away despite conservative therapy such as using stockings and exercising, that would be something that insurance company would consider a covered treatment. Another complication that would be considered a covered treatment would be if you've ever had phlebitis in your leg veins or if you've ever had bleeding from your leg veins. That's considered a complication directly tied into your varicose veins, and that makes it where the insurance companies see it as a more significant problem that would allow for insurance coverage. The most common scenario that we see in our practice where insurance gets involved is when a patient comes in with symptomatic varicose veins where they're having some achiness or tiredness in their legs, or if they're having some swelling related to their leg veins that they've tried to manage with some simple methods like elevating their legs and exercising and wearing a support stocking, and nothing seems to be working too well for them, then typically the insurance companies will see that as a problem that's affecting their lifestyle and that should be repaired. And as long as we document the problems the patient's having and submit that documentation to the insurance companies, then typically they'll consider that a reasonable option to cover their therapies. We always do a pre-authorization with insurance companies to verify that they're going to pay for the treatments before we do them. That way the patient goes into a treatment knowing whether there's any cost associated with the treatment or whether they're going to have full coverage through their insurance company. Medicare also often covers the treatment of symptomatic varicose veins. The requirements for Medicare is that an ultrasound has been done documenting the severity of the vein disease, that the physician documents the significance of the patient's symptoms, and that the patient has actually attempted to manage their disease conservatively with the use of compression stockings, exercise, and elevation. If all of those things have been documented, then it's considered a medical necessity to fix the patient's vein disease if they're continuing to have problems with it, and we can actually do the treatment and submit to Medicare if those specific criteria have been met. The patients don't really have to worry about that kind of determination because the physician will do that for them, meaning they'll have to be assessed by the physician to determine if they meet medical guidelines, and that's once again done through a physical exam, a history, and an ultrasound evaluation.